The language of anatomy is essential in the medical field. It helps doctors, nurses and scientists communicate clearly. Without this language, describing the human body and its functions would be chaotic. Imagine a world where no one understands where the heart is or how to describe its position. This confusion could lead to serious mistakes. Anatomical terminology provides a universal language. It ensures that everyone understands what part of the body is being talked about. Whether you are in New York or Tokyo, these terms remain the same. This consistency is crucial for effective communication and education in medicine. Understanding anatomical terms also helps in learning and remembering the human body's structure. When you know the terms, you can visualize the body parts better. This makes studying more effective and helps in real-life applications, such as surgeries or diagnosing illnesses. In this essay, we will explore key concepts in anatomical terminology. We will break down complex terms into simple language. By the end, you will have a solid understanding of the basics of anatomical language. The anatomical position is a standard way of describing the body. It is the starting point for all anatomical terms. In this position, the person stands upright, the feet are together, and the arms are at the sides. The head is facing forward and the palms of the hands face forward too. This position is important because it provides a consistent frame of reference. When doctors describe a body part, they always refer to this position. It eliminates confusion and ensures everyone is on the same page. For example, left and right always refer to the patient's left and right, not the observer's. In the anatomical position, the body is divided into different regions and planes. This helps in describing locations and movements accurately. It is the foundation for understanding other anatomical terms. Without this standard position, describing the body would be much more complicated. Knowing the anatomical position is the first step in mastering anatomical terminology. It is a simple yet powerful concept that forms the basis for all other terms. Once you understand this, the rest of the terminology becomes much easier to grasp. Directional terms are used to describe the locations of structures in relation to other structures. These terms are essential for pinpointing exact locations in the body. They help in describing where one body part is compared to another. For example, the term superior means above, while inferior means below. Anterior and posterior are other key directional terms. Anterior refers to the front of the body, while posterior refers to the back. For instance, the chest is anterior to the spine. Similarly, medial means towards the midline of the body, and lateral means away from the midline. The nose is medial to the eyes. Another important pair of terms is proximal and distal. These are used mainly for limbs. Proximal means closer to the point of attachment to the body, while distal means farther away. For example, the elbow is proximal to the wrist. These terms are crucial for describing injuries or conditions accurately. Directional terms are like a compass for the body. They provide precise information about the location of structures. Understanding these terms is vital for anyone studying or working in the medical field. They make communication clear and effective. Section 4. Exploring regional terms. Regional terms are used to specify different areas of the body. These terms help in identifying distinct regions and are crucial for detailed descriptions. The body is divided into two main regions, the axial and the appendicular regions. The axial region includes the head, neck, and trunk. The appendicular region includes the limbs. The head, or cephalic region, includes the skull and face. The neck, or cervical region, connects the head to the trunk. The trunk is further divided into the thoracic, chest, abdominal, belly, and pelvic, lower abdomen regions. Each of these regions contains specific organs and structures. The appendicular region is divided into the upper and lower limbs. The upper limb includes the shoulder, acromial, arm, brachial, forearm, antebrachial, and hand manual regions. The lower limb includes the hip coxal, thigh femoral, leg crural, and foot pedal regions. These regional terms help in describing injuries, conditions and procedures accurately. For example, if a doctor says a patient has pain in the thoracic region, it is clear that the pain is in the chest area. Similarly, brachial artery refers to the artery in the upper arm. These regional terms make it easier to understand and communicate about specific parts of the body. Understanding regional terms is essential for anyone studying anatomy. They provide a clear and precise way to describe different parts of the body. This knowledge is crucial for effective communication in the medical field. Section 5. The significance of body planes. Body planes are imaginary lines that divide the body into sections. These planes are used to describe locations and movements of body parts. There are three main body planes: the sagittal plane, the frontal plane, and the transverse plane. The sagittal plane divides the body into left and right parts. If the division is exactly in the middle, it is called the mid-sagittal plane. Otherwise, it is called the parasagittal plane. Movements like walking or running occur in the sagittal plane. For example, raising your arms forward is a movement in this plane. The frontal plane, also known as the coronal plane, divides the body into front, anterior, and back, posterior parts. Movements like jumping jacks occur in this plane. For instance, moving your arms sideways away from the body happens in the frontal plane. The transverse plane divides the body into upper, superior, and lower, inferior parts. Rotational movements occur in the transverse plane. For example, twisting your torso or turning your head are movements in this plane. These planes help in understanding how the body moves and functions. Body planes are essential for describing anatomical positions and movements. They provide a clear way to visualize and understand the body's structure. Knowing these planes is crucial for anyone studying or working in the medical field. Section 6. Major body cavities and their contents. The human body has several cavities that house and protect vital organs. These cavities are spaces within the body that hold and protect organs. The two main cavities are the dorsal cavity and the ventral cavity. The dorsal cavity includes the cranial and spinal cavities. The cranial cavity houses the brain, while the spinal cavity contains the spinal cord. The ventral cavity is larger and includes the thoracic, abdominal, and pelvic cavities. The thoracic cavity houses the heart and lungs. It is separated from the abdominal cavity by the diaphragm. The abdominal cavity contains digestive organs like the stomach, liver, and intestines. The pelvic cavity houses reproductive organs and the urinary bladder. These cavities are essential for protecting organs and allowing them to function properly. For example, the rib cage protects the organs in the thoracic cavity. Similarly, the pelvis protects the organs in the pelvic cavity. Understanding these cavities helps in diagnosing and treating medical conditions. The cavities also allow for the expansion and movement of organs. For instance, the lungs need space to expand and contract during breathing. The stomach expands when you eat. Knowing the locations and functions of these cavities is crucial for anyone in the medical field. Understanding body cavities is vital for a clear understanding of human anatomy. These cavities protect and house vital organs, making them essential for life. Knowing their locations and functions helps in diagnosing and treating various medical conditions. Section 7. Recap and the importance of mastering anatomical terminology. Understanding anatomical terminology is essential for anyone studying or working in the medical field. It provides a universal language that ensures clear and effective communication. From the anatomical position to directional and regional terms, each concept plays a crucial role in describing the human body accurately. The anatomical position is the foundation for all anatomical terms. It provides a standard frame of reference for describing the body. Directional terms help in pinpointing exact locations of structures. Regional terms specify different areas of the body, making descriptions precise. Body planes divide the body into sections and help in understanding movements. Major body cavities house and protect vital organs, allowing them to function properly. Each of these concepts is interconnected and essential for a comprehensive understanding of human anatomy. Mastering anatomical terminology takes time and practice. However, It is a rewarding endeavor that enhances your understanding of the human body. Whether you are a student, a healthcare professional, or simply curious about anatomy, these terms are invaluable. In conclusion, anatomical terminology is a vital tool in the medical field. It ensures clear communication and helps in understanding the complex structure of the human body. By mastering these terms, you can enhance your knowledge and contribute to effective healthcare.